So we are with our Erchonia Percussor. I'm going to do a little percussion on a diaphragm today. Right. Now this can be done with the clothes on. If you want to pull the shirt up on somebody, it doesn't matter. It's up to you and up, of course, the patients, how they're comfortable. I always say diaphragm, just go in and feel. Now we worked on some yesterday. We're going to feel where it's tight again. It's softer here, a little tighter up in here. Okay. You've got a little tighter places up in here. Right. So this feels better. We did work on this some here yesterday, right? Mm-hmm. Okay. Yeah. So one way that you can use this every day in your practice, put it on the low setting and just start at the bottom of the ribs. And I've worked on like martial artists who've had broken ribs, fractures, and I've been very light working around this to help the whole rib system move good again. And as Brahma would say, he used to like to feel the other side of the body. Like you're working on the shoulder, he'd want to feel it go all the way through the body here to have like
a wave,
like a wave release, right? Mm-hmm. Right. So you can do this to the whole body to relax it. To go to his knees, his ankles, and I'll do that for a lot of patients. But today, I want to show you just for the going around the ribs, and feeling where it's tight here, and put pressure over here on the low setting. And this is usually comfortable for most people, but if they're having trouble breathing, the diaphragm's tight, you're gonna find this is sensitive to some, or others it is not. Notice how the ribs are kind of spongy as I'm pushing in. I'm kind of testing them at the same time to see how they're feeling. And then here's the good part. You go in, take your hands, support your hands, push in, and go as deep as their body lets you, and slowly compress in. And percussors don't always have the force, the power to do this move, but this one does. This one can get right into that diaphragm. And what I can do is have this Tom breathe in, and as he breathes out, I can compress in and I just hold. Breathe in again, I'll release a little bit, and out. For those of you who don't want to dig with your fingers, this is a way to get in and release the diaphragm with a percussor, guys. And the ribs notice how they look a little more spongier. They flex more. I go a little higher up. I'm going to push down as he breathes in. He breathes out. And again. And out. That's how percussor's working, right? I'm gonna go the other side here. Same thing. And as I'm pushing in, I'm feeling where I'm getting more resistance. Where are these ribs not moving as freely? There we go. I'll hold there for a second. And he's just breathing normal right now. And then we're going to go back into the ribs here, right inside the diaphragm as he breathes in. Support, he breathes out. All the way down. Look how deep that is. Try and get a shot from over here. Step over here. Look down here so they can see how we're getting in, right? Now remember, try to avoid little edges of the ribs. Try to put that edge of the head here as he breathes in and push down. There it is, right there. And you'll feel the tension of the fascial areas in here. And you'll feel it begin to release and get looser as you work on this. Good, but listen to the breath of the patient. I breathe with him and out. And I hold. That percussor is working. We're putting it to the test here, all right? Good. I'll go back and work again. So as I'm working, I'll go back and kind of feel with my hands. Feel the edges, making sure both sides work. All right, see this? What do these ribs protect? Your organs. If you're a martial artist, someone's kicking you and punching you, you don't want to get your organs damaged. Now look, even I push both sides. Look how that moves very freely now. And then I go in and I test and see how that diaphragm's feeling now, making sure it's not so tight where it was. I still feel it a little tight in here. I wait for him to breathe. I breathe with him as he breathes out. No cough sometimes. Sometimes people will cough stuff up doing this. You may have a napkin ready for them. And out, I push in. Good, look at it, boy, we're digging in there. Right. Now, where I'll go next, as we're working on the fascial areas here, because remember the diaphragm is a lymphatic pump. Just relax your arm. But also lymphatic areas, upper pecs. So as he gives me a good loose arm, I go right to the upper areas of the chest, the major and the minor areas. I kind of get a little tension as I hold the spots. So I'm getting this usually tight spot in here, right at the shoulder joint. The pecs meet the shoulder here, guys. And I hold, and I'll work the shoulder back and around. I'll kind of change the angle a little bit because I'll feel as something begins to release, so it'll get a little softer. You hold down a little bit, work around. Notice I'm giving a little pump to this thing. Here, I'm making sure what? The shoulder begins to move freely again. Right? Go here. Holding the arm, making sure he lets go. So some people try to help you, don't let them help you. Feel with the percussor. And the percussor is like an extension of your hand. This is like your fingers touching and feeling where it's tight. There. And begin to just move and work the fascial areas of the muscle here, guys.
So if you don't have that particular type of percussor, would a genie rub as a last resort work?
Genie rubs can be kind of rough. They're kind of...
No, it's an adjustable.
Adjustable one?
Adjustable
okay,
speed.
you have a newer version, obviously.
Yes.
All right. Every tool has its purpose. And, it's just this little device, because it's got different... They now have so many different heads they've made for these.
Right.
They have many more multiple uses. And I'd have to see yours and see what you're doing with it. But for this, I don't know if it would do this so much, but you could possibly work on the ribs, working around like I'm doing with it with the fascia. Okay. But eventually you need to get you one of these. I mean, you're going to enjoy it when you get one. You really do. I mean, if you love what you do, you want to make it easier on yourself, this is like your best friend in the office.
It's like a swimming though.
So, just go back around and feel. Now, some people have shoulders that don't really expand very well. They lose this limited range of motion. And so I'm going to pretend for a second that his shoulder doesn't go in. His does. He's got a nice flexible shoulder. Let's stay for a second that this person, like this one guy, he comes in for his shoulders. That's the main thing he does at the office. And look inside the armpit area. You feel the different muscle groups, right? And you'll find right inside these areas, you put your thumb in there, it's going to be very tight. Can you just hit the camera around?
Like a serratus area?
Yeah, well, your serratus more down in here.
Lat?
More like a pieces of the lat here. But I'll feel in between the layers there. And I find that separation between the layers of the tissue. All right? So once I find that, I'm still keeping a low setting for this. I'll put this edge of the percussor right in there. I'll use my hip a little bit to help. I'll push right back. I'm gonna pretend, like I said, he's in pain right about here, like my other patient. I'm just gonna hold and get right in between the tissues and percuss right into that. Okay. Then I'll see if it wants to move a little more and push down again. See, I'm holding that muscle down. Like you want that lat to stay flat in there, right? Okay. I'll still go back to here. Always a circular motion. I have to open up the nerve and checking the shoulder, see how it's feeling. Go back in here again. Go back. And watch what I'm gonna do. I'm gonna turn it up just a little bit. I'm gonna go down, and they'll go be a little painful. And as I go to pull back up, I'm gonna put pressure at the percussor at the same time.
Yeah,
As I lift and push opposite directions using the percussor for this distraction-like technique. As I go back as far as he lets me go, pressure and lift. All the way back. Yeah. And then once again, making a little circle. So this is very relieving for shoulder pain, guys. I'll even go up here where the pec is. The pec inserts in here. And I'll hold that pec right where it inserts on the humerus in here. I find where it's most tense, like here. And hold and release. Good. See that? Good loose shoulder. And so I'll take a patient who's here and getting to here, or working on these areas. All in here on the armpit area, working just finding the tight places, doing the percussor, working out the fascia, getting the tendons to release a little bit. Okay, let me show you something else with this. We're going to take the psoas muscle. That thing out of your pocket here. Pocket free stuff. So make sure there wasn't something right there I'm going to push.
Cards.
All right. I asked one guy one day, is everything out there? He pulled out a gun. He goes, yeah, everything's now. Okay. So any other weapons I need to know about here? We're going to look at a psoas muscle. All right. So he holds this up. I'm going to push down, make sure it locks. All right, good. I can help support that for a second. I'm going to keep a low setting on this. Notice I'm always kind of holding this like this because one thing to protect your percussor is letting this part of it be cranked over to the side, because this is the way to protect this connection here. I'll get a little slack in it if there's tension on it. Right? So all I'm having to do is hold this up. I'm going to go right in here, deep as I can get to the psoas again. There, now hold this up. And I'm going to actually put a little pressure. He's not going to hold it as strong as he can, but I'm going to wait till it does a release. This is going to be like a muscle tension release. I'm putting pressure and I'm pushing a little up. A little northern pressure here. And he's just going to hold his leg. So I'm kind of moving it around. I'm following the tightness. Now where it's tight, there we go. There he goes. You'll feel the release. And I just let him just relax the leg now, like the shoulder. I'll move it around for him for a second. And this really relieves some back pain, helps the hip feel more comfortable. Because you know, as you get in here, some of these areas can really bound how we sit a lot during the day. Hold this one up. You're strong. Now, if someone has a psoas that doesn't work, you work on it the same way. Because there may be some tension, maybe a little trigger point in here. Roll it over a little more. Now I'm having to hold the muscle up. I'm going to put pressure on it. I'm going right into that psoas, deep in there. Now you know you've got arteries and veins that pass through this area too as well, right? So it holds it up and I'm putting pressure on his leg at the same time. I'm just going to hold. I'm going to add a little more speed to this one. There we go. Thing is, some people may add a little more power if they can hold their leg a long time. They shouldn't have to hold their leg very long. 30 seconds probably at the max. And if they do, just add more power. There it goes. Then I just let his leg relax. I'll just move around in a nice circle again. So when you go back and check this, hold it strong, it's going to be much stronger than it was before. As you're all about muscles, muscles should contract and they should relax. So if muscles are contracting, they should be relaxing. That's you're losing range of motion.
So can a contracted, if a person, say, has a contracted bilateral iliopsoas, will that affect diaphragm?
Well, diaphragm, think about the body. This is the center of the body.
Right.
It's going to affect everything. Think of the body like a bunch of rubber bands, right?
Right.
And so the centerpiece is the center of the body that controls everything. Look at Tai Chi and Qigong, talk about the Dan Ten. Same kind of idea, right? And so you gotta look at the lower abs versus the upper abs. I'm glad you mentioned that because here we go. Just cue my next thing I was gonna show. Bend your knees, hit them. All right, hold this here. So I'll bring their knees up where they're comfortable. And hold those top. I'm gonna pull down. Okay, that locks. Go down a little further. Hold this strong. That locks. I'm gonna go past that plane. Hold this right here though. And see if his lower abs doing. Okay, so you can see his body locking. That's good. Go over to the side. Hold this strong. Okay, that locks. Go over here. Go the other way. All the way over that way. Let your knees come up a little more. There you go. I'll resist here. Okay, there's a little weak spot. We're looking for one, lower abs, obliques, seeing where he's weak in. Especially if a woman's had a baby, right? You get that percussor, you work the lower abs. In his case, this is obliques, it's over here. You'll find a little weak spots here. Now with the percussor, like the low setting, when you're trying to find where it is, if someone has, I'm gonna pretend for a second, he has some weak lower abs. If this goes weak, I put the percussor in and I hold, and what happens when you find the spot, it locks. When it's weak, it locks, right? And so in that point, then we go to the lower ab, push down and push up. You're working on the fascia now. This is a fascial release for the abs, especially like I said, my patients who have just had a child and all those lower ab muscles aren't working, and you'll feel it have this little release. Let the leg down, put it back up, and leg will be strong again. And so when they got that kind of waddle walk going, when you get the lower abs turned back on, they're able to walk more taller again. Okay? Now, we're gonna work on Tom here. We're gonna get to these oblique muscles here. I'm gonna take just one of his legs over. Now resist this a little bit here. Once again, there, okay? So I'm going into still his lower abs here. I'm gonna put pressure in and tension up. I'm gonna hold. Now, these are just things in practice you go in here for a moment and just feel for some kind of slight shift in the tissue. These are releases that you're feeling for, right? I already feel his muscle, already giving these little releases there, right? But for purposes of getting his obliques well, I'm even gonna go along the tissues along the ribs here. And I'm putting pressure in and up. There's his rib cage, down to the side, or his diaphragm. I'm just going along the ribs. Okay. Going back to his lower ab, down here on the sides. Pressure. It only takes a moment to do this. You know, over to the side, I resist them. The knee's gonna be locked in a rock hard. So when you work with the lower abs, even your low back patients are in a lot of pain, those lower abs are silent. He did a good job of holding his knees up, all right? Tom, maybe borrow somebody else. Thank you, Tom, for a second. Thank you, Tom. Okay, let's see. Come up your knees. Let it come up. Let your hands go to the side. Just do the, there you go. Okay, so you let them go as far as their knees comfortably will come up. Let them come up. Let them come up. There. Now hold this strong. Good. See how the whole body moves? It locks. Come medium. Okay. Come down. And come a little past. So notice the legs aren't stripped. We come a little past that plane. And see if she holds. And then they give out. All right. And that's what I'm looking for. Now I can hold both knees and do it, or just one. It doesn't matter. Remember, you got the upper, middle, and lower abs. Most people who sit a lot, or depends on their condition, what they've been through. If they have low back pain, for sure, those lower abs just aren't working very well. I'm gonna put a little pressure here on her leg. Just resist here. Resist when I pull, and I'm gonna feel where it gets tight. Look at there, right there. Okay, lefties down. All right, ready? She's gonna retire soon anyway, so we gotta make sure her abs are all working. Pressure in, pushing up. Remember, gravity pulls everything down. Push in, compress up. Now, if you're doing the kinesiology, you can also use your body like this. You can straighten that arm all the way. If you want to know where to go, where does the arm get strong? There it is. It's actually saying over here. Now look, I'm gonna use our arm as an indicator. Remember, everything's connected in the body. As I compress up, I'm gonna hold, and I'm gonna let her arm tell me when it's done. I even changed the angle a little bit as I feel it move and release, and there it goes. Right? So you can always use the body to ask questions about itself. Let's go down and back up. Now hers was like here, so now watch. Lock, her whole body locks again. Right? Over to the side, keep the knees up, resist over here, resist this way. Okay, resist over here, let this come over. You can hold the table. Okay, resist here, okay, that locks. So over here, once again, we found another weak spot. As I pull here, I want to just pull there. I use my fingers, but once again, verify with your percussor. This is your hands that you're using this body. I push down and pull up, pressure, put pressure right here. There, it locks. So let's let your knees go down. I'm gonna use an indicator muscle. Up and in, up and in. Change the angle a little bit. You'll feel those little releases. They're very subtle, guys. Our chiropractors are supposed to feel a hair in the phone book pages, right? So many pages we can feel a hair. There he goes. And she releases. I'm gonna go a little more to the side.
I feel cramp on my
All right, so
back.
things are moving in her back. All right. We'll get to that in a second. Let's make sure this is all. So as soon as something comes on, what happens? The body gets a cramp or a tightness somewhere else, right? Strong here, locks. Okay, now where'd you feel the one in the back?
Yeah.
Okay, so stay there, just stay there. So. Something's changing, right? The body's such a wonderful computer. It always tells us something else to look at. Hold this in, like this strong, okay? Hold this up, okay? Hold this out and turn this here. Now resist when I push up here. Okay. Up here, just here. Down here, there it goes. Okay, so we found another spot. Let's sit up for this one. So,
I have the percussor. Are you okay? Yes.
So people have mid-back tightness and pain. Hold it, palms forward, and just like this, a little pressure. And they don't want to make it as hard. They don't want to resist me 100% because people can be strong, right? And I'm looking for the place. Go a little lower, just like we created when she was lying down. Hold it strong. It's weak, and so we look where it's there. So look how the lat comes down. Put pressure on the lat. Put up and at an angle. Hold this pressure here. All right. So once again, we're gonna look for the shoulder to release. This is this cramp she's having back here. This is an easy one. There it goes. So just lets go. And that way, when we retest it, solid, strong, down here, strong. Okay, is the cramp going?
Yes.
There it goes. Okay. All right, so you'll see that this is one I actually use quite often, guys. When someone has tightness in the back, palms forward, here. Look at all the traps we have, all the way down, upper middle traps. Hold here. A bit pressure here. Pressure here. Okay, and I find a weak spot. Hold it strong. There he goes. Now I'm pushing what? Up against gravity and out to the side. Hold the pressure down. Yeah, this is really comfortable for patients. This doesn't cause a lot of pain stuff. Look at there. It's almost ready. Almost ready. There it goes. Yeah. And so when you retest that area of the body, it's more solid.
So how would you do, like the suboccipital area? That's a really, really chronic.
Well, let's change places. One martial arts, somebody goes, well, how would you do if someone put you in a headlock like this and they grab your eyes, they hit your toes and go, come on up. At least that's how teachers should tell me. I'd ask those questions and go, that's a good question. Come on up, Dad. Yeah, I'm laying on the ground going, I'm not asking that question again. Sit on the very end. Actually, let's turn your back towards me. So put the camera over here so you can sit over here. And I'll finish a lot of people like this, especially if you ever get a patient that's spine so stiff and doesn't move very well. They probably have a lot of these oxalates going on. This is why the percussor works so great, because if you're doing, you obviously can't move a stiff spine a whole lot, but you can do all the light touch therapies, the 5 flows we're talking about, a lot of touching reflexes to turn muscles on. But one thing they always love is I finish with the percussor. I turn this up on their tolerance level, a little higher. You don't want to go so high where someone says, I feel like you're shaking my brain. Well, that may be a little too high, right? And I'll just prop the head up, and I go right here under the occiput. Remember how the insertions of these tendons are right here, the upper traps? Man, I get that really well. Let their neck move, right? I like this done to me too, so. Look at his neck. Making sure all the bones, I'm going down the segments of the cervical, making sure all the bones move. Once again, using a percussor like it's my hand. He rotates. Where did I feel tension? Now to have fun with this thing, you crank it up, roll them over, and get that trap here. Keep rolling, looking for the little releases you have, feel where it's tight. Oh, these are wonderful. Even if I think if I just did this all day to patients, just use my percussor, I think they would come in just for this. And if his nose begins to itch, you know you're doing a good job. Okay, now roll it over there. Yeah. Right on that hard spot. Let's move it around. Now, looking for John, I brought another piece of this percussor in today. Don't move. I brought one of my good friends here. There he goes. It's the red one. Okay. They have all these other, they have attachment, looks like things that you use in a field to like work with the dirt on the ground as these little rollers. I didn't bring these today, but you can roll out hamstrings and thighs in the back with these rollers, right? I love them. Now watch, it's really easy. Change tools real quick. You're ready for operations. Once again, I'm going to the same spots, but watch his reaction. And if he starts singing like Hallelujah or something like that, you know you've got the right spot. And these definitely get more penetration, right? So if you want to get into these hard spots, work on trigger points, guys, man, this is the thing.
That's the thing.
Yeah. Notice I kind of roll it around a spot. Okay. I compare this shoulder, move this shoulder around here. Go like this, move it around as such. Compare that one to this shoulder. All right. There we go.
Yeah.
Yeah. There we go. And once again, it's to their tolerance, right? To their tolerance. Because believe me, this thing, it's got some horsepower now. Watch this. Woo! Hey. So I don't always recommend going too high with these things for these, but once again, you get people who got some backs that are like rocks when they come in, right? You got to break through the rocks, break those fascial points up. Look at that, right on that ridge or that trap. So instead of wearing your hands out during the day, guys, and your percussor's your friend. Now, all those nice trigger points you get down the spine back here, you know, all those, right? If they're laying face down, you get into a trigger point. Oh, yeah.
Oh. That's it.
And he's going to tell me, I'll give you 10 minutes to quit that. Right? I don't stay on them very long because these can be very painful for a lot of people, right? But if you never had trigger point done with this device like this, guys, you don't know what you're missing. Yeah.
I think he shook all the oxalates out.
He got his oxalates going. All right. Percussor, guys. You got to have one for practice.